Welcome. I am Martha Stipsitz, Director of Transplant Services. Thank you for choosing the Washington University and Barnes Jewish Transplant Center. Your transplant journey begins today with the education provided in this video. I trust you will find this video valuable as our team provides you with information about each step in the transplant process. You will learn what to expect in your transplant evaluation, the factors used to determine whether transplantation is the right option for you, the process for being added to the National Transplant Waiting List, and information about the surgical transplant procedure and recovery processes. This class is a requirement for you to proceed with your transplant evaluation. Please write down any questions you may have during this video. You will have an opportunity to discuss your questions with a nurse coordinator within the next week after completion of your educational video. Thank you for your attention to this video and for your commitment to your health.
Welcome to the liver transplant education class. This is an orientation class for patients, family, and friends. We're going to review treatment options for liver disease, discuss liver disease, overview of the evaluation process, discussion of listing process, responsibilities of being listed on the UNOS waitlist, transplant outcomes, and questions. This is the liver transplant team. You are the center of our team, and as you can see at the top, you have the transplant coordinator. You have transplant hepatologist, which is a medical liver specialist. You have transplant surgeons, transplant administrative assistants, financial coordinator, social work, pharmacist, in which we have 3 dedicated transplant pharmacists, nursing staff that you will encounter on the inpatient floors, clinic staff, and of course your referring physician. Our team is broken up to pre-transplant coordinators and post-transplant coordinators. The pre-transplant coordinator, you will be assigned to one who will be your main coordinator through the pre-process prior to transplant. Then after transplant, you will have a dedicated post-transplant coordinator. If for any reason your primary coordinator is out of the office, there will be another coordinator caring for you. And all of the coordinators are nurses. The role of the coordinator. We are the center, we are your main contact person for the transplant team. We will help manage your problems and concerns. We will coordinate your testing. We will provide you with education to you and your caregiver throughout this process, and we will ensure the plan of care is communicated. If you have any questions, please call our office and address them with us, and we will communicate that with the team. What does the liver do? The liver is not like other organs when you can feel them working. The liver is kind of an organ that you don't know that there's something wrong until you're told by a medical profession that there's something wrong with it, usually diagnosed with labs or with imaging. The liver cleanses the toxins out of your blood. It produces proteins, sugars, coagulation factors, and stores vitamins. Coagulation factors are what clot your blood. So many times if you just bump your arm very lightly, you will have a big bruise on your arm. And many times when we do your evaluation lab work, we will have low vitamin levels come back, and we will require you to start taking some vitamins because they're not being produced by your liver. The liver also produces and stores bile. What are signs of liver disease? Ascites, abdominal fluid. The problem with having ascites is you can develop an infection. This infection is mainly caused when you get the ascites drained. That's why we know that you have to get it drained for comfort and for medical reasons, but we try to avoid having too many large volume parencytesis done. So usually we try to limit to once a week. That way we lessen the risk of having the infection. Encephalopathy is confusion. Usually your family member will identify this before you realize that you're confused. If you do realize that your family member or yourself are confused, you should no longer be driving. Muscle wasting, which is extreme weakness. This is because the proteins that we discussed on an earlier slide are being pulled out of your liver due to the liver disease, and so now it's being pulled out of your muscles making you extremely weak. Then you have fatigue, which is extreme tiredness. You may be so fatigued that you can't even walk to the mailbox and back, but we do ask that you try to do as much physical activity as possible so you're strong enough for transplant. Jaundice is yellowing of the skin, eyes, and dark urine. It's usually like a tea-colored. Variceal hemorrhage is vomiting blood. That is a medical emergency, and please call 911 if you have bleeding, if you're vomiting blood. We try to prevent this by doing a scope down your throat to see if we can find any of these varices and fix them prior to this happening. Easy bruising happens because your liver is not producing the factors that make your blood clot. Types of liver disease. Liver cell disease. Hepatitis, which there are different types of hepatitis, which is inflammation of the liver. There's liver cancers, and then there's also alcoholic cirrhosis. And we have bile duct diseases, cholangitis, and bile duct cancer, cholangiocarcinoma. There's also metabolic liver diseases, such as NASH, and inherited diseases, such as Wilson's or alpha-1. The diagnoses of your liver will be discussed further in your surgical appointment. What is cirrhosis? It's a progressive, chronic liver disease that produces scarring of the liver tissue. It is not uniform, it leads to liver failure, and it is irreversible. It's kind of like having a bad burn onto your tissue to where it heals somewhat, but it still leaves a scar there. So the skin, the tissue is never the same. Why liver transplant? Why would we need to do this? Because you have the irreversible cirrhosis, you have a liver cancer, you have a metabolic disease, or you have rapid liver failure. Rapid liver failure can occur when your physician prescribes a medication for you or you take an over-the-counter medication. One common example of this is taking Tylenol or acetaminophen in a dosage that's too much for your body, which exceeds the recommendations of either your physician or the bottle. When this happens, you are in the hospital and usually do not leave the hospital until you have a liver transplant.
Hi, I'd like to talk to you about steps in the liver transplant evaluation process. Although this slide looks like it's a straight line from evaluation to transplant, there are many different lanes you can take off. There are more lanes off than there are that head straight towards transplant. This begins with the orientation class, is to provide you with more information about liver transplant, the evaluation, and possible outcomes. The evaluation will consist of many different tests, and we'll talk about that next. The evaluation is reviewed by the transplant committee, and then specialized testing, a referral to a specialist, or possible listings may be recommendations to come from this committee. And there will be continued follow-up. Regardless of the decision of the committee review, you will be notified by your coordinator with a phone call and with a letter. From this slide, anyone who's had their blood work drawn can tell you that there are many, many tubes of blood that are drawn. There's also radiology testing, there's heart testing, there's lung testing. If a nurse called me on the phone and asked me if I had any heart or lung problems, I would tell them no, I didn't. However, I used to smoke, and apparently I'm too short for my weight. So I could have heart or lung problems, and I may perhaps need to see a lung doctor or a heart doctor. There's cancer screening that's done. Everyone needs to be current on their colonoscopy if they're over the age of 50. Women need to be current on pap smear and mammogram, and men need to have a PSA blood test, which has already been ordered if you're a man. You will see one of our physicians who will do a physical examination, and there may be referrals to specialized physicians if needed. Here's some questions you want to start thinking about. What is my risk of dying from liver disease without a transplant? So what is that risk? Because every operation carries a risk. Having your appendix out carries a risk, and a transplant is certainly a bigger operation. And what is my risk having the surgery? When my risk of having the surgery is less than my risk of living with my own liver, that's the time I need to be looking at a liver transplant. Will I live longer with the transplant? How long will the transplant last? None of our doctors have crystal balls. They can't tell you how long the liver will last. They can give you information about the natural course of your illness and how long they can expect a transplanted liver to last in your case. Barnes-Jewish Hospital and Washington University screens all of our donor blood for infectious diseases, which includes HIV, hepatitis, CMV, and EBV. CMV and EBV are infections that many of us have had. CMV infection, for example, is something that I may have had but I'm unaware of. It's important in pregnant women and it's important in transplant patients. What we'll do is look and see what your blood test is in relationship to your donor, and that may mean an adjustment in medications. If the donor was exposed to an infectious disease within the last 7 days, it may not show on testing. Donor families are asked many questions prior to donation in order to screen for high-risk behaviors. They're trying to get at those behaviors that are high risk through a variety of different questions. I am the parent of some young 20-somethings, and I think I know what they're doing, but I don't always know. But they would be asking me many questions about their behaviors that I'm aware of. Donor families are being as honest as they can be in a very, very difficult time. Increased risk donors have been found to be very suitable donors in liver transplant. You're going to learn more about this donor at your surgical appointment, but I want you to think about it overnight before you go to see your doctor, because it's sort of hard to wrap your head around. These might be donors who have a known history of drug use, sex with prostitutes, men having sex with men, perhaps hemophilia, any risk of HIV, blood transfusions. Perhaps they've had a lot of IV fluids, which has diluted their blood. It could even be as simple as someone who they don't have a history on or who's on hemodialysis. Again, we use the most up-to-the-date testing possible to limit any risk to you. The thing that is important to remember is what you're agreeing to is a phone call. The doctors will tell the nurse on call what information is available about the donor. You would receive that phone call and we would tell you what that risk is. There's times when I'm maybe at work, I'm not feeling that well, but I can still work. I'm going about my daily life with liver disease and I'm listed for a transplant. But what if I've had a number of trips to the hospital, perhaps a couple into the intensive care unit? My willingness to accept a different risk may change over time. If you say no, you're not going to hear about any of these donors. If you say yes, I want that phone call, we will call you and tell you what we know about those donors. Again, you will be discussing this with the doctor at your surgical appointment. Here at our center, we also transplant hepatitis C donors. You'll learn more about this donor type at your surgical appointment as well. A special consent is required for you to receive offers of this type of donor. These are donors that have had a known exposure to hepatitis C. I think we've all seen those ads on television for treatment for hepatitis C, which can now be cured. There is a chance that you could get hepatitis C after transplant, and this is determined by lab work. There are medications that will cure hepatitis C. Many transplant centers successfully perform this type of transplant. These are livers that are perfectly good, except that they have the hepatitis C. What we've found is that people who take increased risks tend to be younger. When I was 19 years old, if it was an icy day, my friend and I would slide down the sidewalk to see who went further. I'm a little older now and less willing to take those kinds of risks, so I walk like a penguin. These are the kinds of things that you have to remember. Younger people are often willing to take more risks. They also have very healthy organs. I'd like to talk about the multidisciplinary team conference. We meet once a week, and this includes all team members. We review all of the testing and consultation reports. This committee makes recommendation. It's never one person making the recommendation. The committee makes recommendations regarding listing, whether people are not quite ready, or if they're not a candidate for some reason. There may be alternatives to transplant. There may be hepatology management where you're followed by the liver doctors. Perhaps it's too early for transplant. You could be referred to your referring doctor. Test results and recommendations would be sent to this physician. We've seen patients who are either too well or too sick for liver transplant and decided that they would rather follow with their local doctor than come back and forth to St. Louis. There may be oncology management, including medical management or interventional radiology management. What is a MELD score? The MELD score is the model for end-stage liver disease. This tells us about the need for transplant in the next 3 months. This ranges from 6 to 40 is what the score would be. This is based on lab values, which include your clotting time, your bilirubin, and some measurement of your kidney function, including your creatinine and sodium. This score can go up and down. It's similar to the saying, you can't step in the same stream twice, by virtue that stepping in the stream has changed it. So we can draw your labs on Monday and receive one score, and Tuesday receive a different score. Those are generally very close together. What we're watching for is how high it goes. If your MELD score is continuing to climb, we will update you to keep you as high on the list as we can.
You should know your MELD score at all times. You'll have your labs drawn as part of the transplant evaluation process, and we will be able to notify you of your MELD score during your physician visits with us. After your evaluation is complete, we'll notify you how often we want you to continue getting your labs drawn in order to continue to monitor that MELD score. You can go to any lab that's convenient for you. We do recommend typically a freestanding lab, not a lab associated with your doctor's office, just so that we get the results in a more timely fashion. So expect a phone call from your coordinator with your updated MELD score, and we will be able to provide you with the next date that it is due. This next slide shows our testing schedule and how often you should have your MELD labs drawn. As you can see, the higher your score, the more often you need to have your labs drawn. So in other words, the sicker you are, the more often those labs need to get drawn. I like to point out on this slide, you may be asked to have labs drawn more often. For example, if your MELD score falls between the 11 to 18 range, the team generally would prefer that you have your labs drawn every 30 days rather than every 90 days. And our reasoning for that is we want to know if your MELD score is increasing now rather than later in 90 days. We'd like to have that documentation sooner rather than later. The lab work can be done at a local lab, as we talked about. It is important to let us know the day that you have your labs drawn, so that we can be sure to follow up on lab results. If we don't have results within 2 days, we'll make sure to call that lab and ask them to forward us those results. Cancer screening may occur every 6 months to 1 year. We include that in your return office visits, and so we do imaging every 6 months to screen for cancer. The waiting list is managed by the United Network for Organ Sharing, or UNOS, as we like to call it. You will be notified when you are placed on the waiting list by both a phone call from your coordinator and a letter sent through the mail. You do have responsibilities to remain on the wait list, which we will review later in this presentation. As far as your position on the list goes, it's based on a lot of things, but the main ones would be blood type, your MELD score, and waiting time. So the one point I do like to make is if you hear other liver transplant patients talking about their place on the transplant list, it's important to consider they're probably talking about where they are within their own blood group list, not the list in general. So it's important to understand that, again, the list varies based on your blood type. This next slide talks about different listing options that UNOS offers. You can be listed at multiple centers in different regions of the country. So if you are interested in this, you will be getting a pamphlet that has more information pertaining to this information and how you can proceed with that. And then you can also transfer your care to another transplant center without loss of waiting time. So if you do If your circumstances change and you are finding yourself needing to move away from our center, we can transfer your waiting time to another center as long as they accept you as a patient. While you are on the waiting list, it is important to follow team guidelines. Number one, it's essential that you keep all of your follow-up appointments. And we understand here that weather does play a role in being able to follow up, especially in the winter time. So if you feel that you are not going to be able to make it to one of your return office visits, please call us and let us know, and we'd be happy to get you rescheduled. We understand that things change. So just please keep us updated if you cannot make it to a scheduled appointment. Next, please take all of your medications as directed. Don't increase or decrease your doses. Please call us if you feel like you need a dose increase on your diuretics, say, so that we can review that with our physician and see if that's an appropriate medication change. There is one exception to this rule, and that is lactulose, and we will be able to discuss that with you further in person, but lactulose is the one exception to this rule where you can increase and decrease your dose as needed. The next bullet point, exercise. I don't mean train for a half marathon or anything like that. Just get in the most exercise you can. Do what you can every day, even if that's just walking to the mailbox or going to the grocery store. Whatever you can do, please keep doing it because we find that the more in shape someone is going into transplant, the quicker they recover after. Manage your stress, stop smoking, no drinking alcohol or drug use. It's important to find a way to manage your stress that isn't any of those things. I know a lot of times people do use smoking, drinking, drugs as a stress reliever, but as a liver transplant recipient, you cannot be doing any of those things. So whatever works for you, whether it be journaling or going to a counselor or church, meditation, whatever it is, please find something that works for you to help manage your stress now before transplant so that you are comfortable with it by the time you get your transplant. And that is also a high stress time as well. Additional education that may be needed. Insulin start class. So it's important that you discuss with your primary care provider or perhaps your endocrinologist if you have one to see if they offer a class related to insulin usage or diabetes education. If you are pre-diabetic, it's important to know there is a chance that the medications we give to you after transplant to prevent rejection, steroids, will increase your blood sugars and may perhaps push you into full-blown diabetes. And you may need to start insulin either for a short period of time or potentially for the rest of your life. If this is the case for you during admission, we will have a diabetes nurse educator come to your room and teach you all about insulin and how to administer it at that time. Post-transplant education booklet, we will mail this to you the day that we place you on the waiting list. We feel it's very helpful to have this information so that you can start preparing for transplant before the transplant occurs. So we do recommend that you take a look through that and become familiar with the information there. It'll be a lot less overwhelming for you if you do this after your transplant occurs. So this next slide, it's really important to consider the cost of transplant between your hospital stay, medications, lodging, travel, co-pays for visits and labs, and time off work. It can really become overwhelming and be a lot of money that adds up pretty quickly. So because of that, we do have you meet with one of our financial coordinators as part of your evaluation process. You are assigned a financial coordinator as part of the liver transplant evaluation process, and you will be meeting with them or speaking with them at some point during the evaluation. Questions to ask: what will your out-of-pocket costs be? Do you need a supplemental insurance policy? And do you have travel and lodging benefits? The financial coordinator will be able to let you know the answers to all of those questions and be able to assist you with others as well. This next bullet point is very important. You need to inform us of any insurance changes to help prevent lapses in care. So whether your insurance changes in a week or 6 months or 6 years, if you're still being cared for by us, we need to know about any insurance change, no matter how small you think it may be. This next slide starts to talk about the actual transplant procedure. Generally speaking, it's a 6 to 8 hour surgery. Certainly it can take longer than 8 hours, but on average 6 to 8 hours. The gallbladder will be removed, so after you have a transplant, you will no longer have your gallbladder. The typical hospital stay is usually 5 to 10 days, depending on how well you're doing. If you're doing really great, I have seen people discharged as early as 4 days after transplant. And of course, I've seen people stay longer than 10 days as well, but that's just a general 5 to 10 days is something that you can expect. You will go to the ICU immediately after surgery and be there for at least usually 24 hours, and you'll learn more about the specifics of transplant and the specifics of the surgery in your surgery consult. So one thing I do like to point out about this slide is where the surgeons have to cut your blood vessels and re-sew them to the donor blood vessels. There's a lot of places they have to do that. So there is a potential for you to return to the operating room a day or two after the transplant surgery if the surgeon feels that there's a need for you to go back to have a look and make sure that everything is connected properly.
We've talked about the transplant itself. Now we're going to talk about possible outcomes of the transplant. The liver starts working immediately. There could be some slowed or delayed function. This is not necessarily bad. Your new liver's been through a lot before it was transplanted into you. Sometimes it's a little shocked and takes a while to wake up. Failing immediately is called primary non-function. It's extremely rare and happens less than 5% of the time nationwide. We don't know why, and there's no way to predict it. If this happens, you go to the top of the list nationwide, and you will not be leaving the hospital without another transplant. You can review our center's transplant outcomes by visiting www.srtr.org. If you have questions about this information, your transplant coordinator can help you. We're very proud of our liver transplant program and our outcomes and how well we compare to the rest of the country. There are complications of liver transplant. There can be infections, rejection, weight gain, diabetes, and cancer. Rejection is not unexpected, so we look for it and treat it when it occurs. A rejection does not mean your liver transplant will stop working forever. Signs of rejection may include fever or generally not feeling well, but you may not exhibit any signs, which is why we frequently ask you to have labs drawn so we can assess the function of your transplanted liver. Rejection can be diagnosed by reviewing your labs. That's why it's so important to get your labs when we ask. Transplant does not cause cancer, but the medication that you take to keep your liver healthy may make you more susceptible to cancer and infection. A normal immune system helps fight off cancers, and your medications suppress the immune system. One of the most common cancers after transplant is skin cancer. You will be required to stay in the St. Louis area for 2 to 4 weeks after transplant if you live more than 2 hours away from the transplant center. If you live a great distance, such as California, you may be asked to stay longer. We ask you to stay close to the transplant center so you can return quickly if needed. Regardless of where your home is, everyone must have a caregiver that is available 24 hours a day, 7 days a week after transplant. Your caregiver will help take care of you and get you to and from your appointments. You will return to clinic to see the surgeon weekly for the first month. Months 2 through 6, you'll be seen every month to 6 weeks. You will then return to see the hepatologist at month 9 and month 12. You may be seen more frequently as needed. Blood work will be done at least twice a week for the first 3 months, and this will usually be done by home health. This will decrease to once a week, and then every other week, and then monthly. You will take the anti-rejection medications for the rest of your life. You may have unexpected admissions to the hospital, and they will most likely be here. The transplant team will keep a very close eye on you, and we will want to make sure everything is okay. You will be on several new medications after your transplant that help to keep your new liver healthy. Anti-rejection medications are taken twice a day, every day for the rest of your life. These medications prevent your body from seeing your new liver as foreign. Your anti-rejection medications will be adjusted based on your specific needs. Anti-infective medications are taken to protect you from bacterial, fungal, and viral infections. Anti-infective medications such as Bactrim, Valsite, and Diflucan are taken for as long as you need them based on your needs. Some may be discontinued in the weeks or months following your transplant. Other medications that you take now for blood pressure, gout, diabetes, and cholesterol will likely be resumed. These problems are not cured with your liver transplant. There are restrictions after transplant to keep you and your new liver healthy. Any herbal or over-the-counter medication needs to be discussed with your transplant pharmacist before taking. Dietary restrictions are also a part of your care after transplant. You should not eat grapefruit, pomegranate, or star fruit. These foods will interfere with the absorption of the medications that suppress your immune system. It is okay to have other citrus fruits like lemons, limes, and oranges. We also do not want you to use alcohol, marijuana, or CBD oil. CBD can also interfere with the absorption of medications as well. There will be physical restrictions such as driving and moving heavy objects or heavy lifting. These restrictions are removed after you're fully recovered from your surgery. If you're receiving home health, you are considered homebound and should not be out and about. It's very important to let us know if you have any changes in your health. Changes to your health, like visits to the emergency room, hospital admissions, because we may want you here. And again, always let us know changes in your insurance. It's important to know if you have a fever higher than 101, you could have an infection that needs to be treated. Any increase in swelling or abnormal weight gain, changes in your level of thinking, increased abdominal pain that's different from any discomfort that you normally have. Also, if you are vomiting blood or passing blood in your bowel movements, please seek help immediately. Call 911 if you are vomiting blood, even before you call our office. You or a family member can let us know when you're able. This is a very stressful time. It's normal to feel overwhelmed. If you or your caregiver notice any changes in your mental status, signs of depression, such as feelings of helplessness or hopelessness, or feelings of wanting to harm yourself, we want you to reach out. You can call your coordinator or your social worker. Do not be ashamed or afraid to ask for help during this very stressful time. If you feel there is an immediate danger, call 911 for any life-threatening emergencies. We have multiple resources that are available to you. There are online resources that we encourage you to use. We are happy to provide as much information as you want and need about transplant. Our social worker offers a monthly support group meeting. People that have walked in your shoes and know transplant from the other side attend these meetings. They can provide you hope and encouragement in a way that we can't. The United Network for Organ Sharing, or UNOS, is the organization that is charged with helping transplant candidates, recipients, and family members understand how organs are distributed and report data from all transplant centers. You can call this number if you have a problem with our center specifically or the system in general. You can call on the phone or contact them through their website at www.unos.org. We have been taught to thank others when they give us a gift. How do you repay this gift that has been given? The donor family has given this wonderful gift at the most terrible time in their life. The first thing you can do is take your medications, have your labs drawn, and keep all of your doctor's appointments. After the transplant, you may want to contact the donor family. We suggest that you wait at least 6 months, and you can write a letter and give it to your post-transplant coordinator. Your coordinator will forward this to the team that supports donor families. You are certainly under no obligation to send to or receive correspondence from the donor family. That is a personal decision that only you can make. Thank you for watching this, and if you have any questions, feel free to call your coordinator, who will be happy to answer your questions.